Hello and welcome. Let's get started right away. Have you ever tried taking Tadalafil, hoping for a certain result, but felt let down and disappointed? If that's happened to you, please know that you're definitely not the only one. It's a pretty common experience, but the answer might be easier than you think. Actually, studies have shown that as many as 30% of men who believe Tadalafil isn't helping them may simply not be taking it as they should. When these little errors are fixed, up to 69% of those very same men start to experience the positive results they were looking for. You might just be making a few simple mistakes that are keeping you from getting the most out of your medication. This can lead to wasted time, wasted money, and a whole lot of unnecessary frustration. In this video, we're going to carefully explain the most common mistakes people make when taking Tadalafil. My aim is to give you a clear, practical guide so you can learn the right way to use it, get the best possible results, and feel confident again. As Dr. Anya Sharma, specializing in men's health, I've personally seen how a little bit of understanding can make a huge difference. First, it's important to understand just what Tadalafil is and how it actually works. Tadalafil is in a group of medications called PDE5 inhibitors. Simply put, it's a vasodilator. What that means is it helps to relax and widen your blood vessels, which allows more blood to flow to certain areas of your body, including, of course, the penis. This increased blood flow makes it easier to achieve and maintain an erection. Now, Tadalafil is a bit special because it comes in two main ways to take it, and it's really important to know which one you're using. The first way is for use as needed. This is usually a higher dose, like 10 milligrams or 20 milligrams, that you take only when you expect you'll be sexually active. The second way is for daily use. This is a much smaller dose, usually 2.5 milligrams or 5 milligrams, that you take every day at the same time. The goal here isn't a quick effect, but to keep a consistent, steady level of the medication in your system. This means you're ready for sexual activity at any time without having to plan ahead, and it also works as a longer-term way to help improve your overall vascular health. Knowing which method you're using is the very first step. Now, let's get into the 5 most common mistakes that could be getting in the way of your results. Mistake number 1. Not waiting long enough for it to take effect. This is by far the most common problem I see. Many men take Tadalafil and expect it to work like a pain reliever, in just 10 or 15 minutes. But that's not how it works at all. Tadalafil needs time to be absorbed into your bloodstream and start to affect your blood vessels. If you're taking the as-needed dose, you should take it at least 60 minutes before you plan to be sexually active. Even then, the medication usually reaches its strongest effect about 2 to 3 hours after you take it. So, if you take a pill and then immediately try to be intimate just 20 minutes later, you're likely going to be disappointed because the medication simply hasn't had enough time to work. The answer is simple. Plan ahead. Give the medication the time it needs. Taking it 1 to 2 hours beforehand is usually just right. Mistake number 2. Taking it with a heavy, fatty meal. What you eat really does matter. If you eat a big, greasy meal, like a cheeseburger with fries or a large steak dinner, and then take your Tadalafil, the fat in the food can really slow down how quickly the medication gets from your stomach into your bloodstream. This doesn't mean it won't work at all, but it will delay when it starts working, and it can even make it less effective overall. You might find that it takes much longer to kick in or that the effect isn't as strong as you were hoping for. The solution here is to take Tadalafil on an empty stomach or with a light, low-fat meal. This allows it to be absorbed the fastest and most efficiently, making sure you get the full effect when you need it. Mistake number 3. Assuming it works without any sexual stimulation. This is a very common misunderstanding. Tadalafil isn't a magic pill or some kind of aphrodisiac that will automatically give you an erection. It helps make it easier, but it doesn't start things on its own. Think of it this way. The medication gets your body ready, improving blood flow and preparing things, so to speak. But for an erection to actually happen, your brain still needs to send the right signals. That requires sexual stimulation, whether it's something you see, physical touch, or just feeling aroused mentally. If you take the pill and then just sit on the couch watching the news, waiting for something to happen, nothing will. The medication works in response to arousal. The solution is to enjoy foreplay and create an environment where natural arousal can happen. The Tadalafil will then be there to help your body respond physically to that arousal. Mistake number 4. Being in a state of high stress or anxiety. Your mental state is incredibly powerful and has a direct physical effect on your body. When you're stressed, anxious, or worried about how you're going to perform, your body releases a chemical called adrenaline. Adrenaline is the fight or flight hormone. It's designed to prepare your body for danger by tightening blood vessels and sending blood to your muscles and vital organs. This is exactly the opposite of what Tadalafil is trying to do. Tadalafil is a vasodilator. It widens blood vessels. Adrenaline is a vasoconstrictor, which narrows them. If your body is full of adrenaline because you're stressed, it can completely overpower the effects of the Tadalafil. You can take the pill perfectly, but if your mind is racing with anxiety, your body's own chemistry will work against it. The answer is to make sure you're in a relaxed and comfortable place. Try to minimize pressure and focus on connection and intimacy, not just on how you're performing. If you often feel anxious about performance, it's a good idea to talk about it with a doctor or therapist. And mistake number 5, for those of you taking the daily dose, giving up too soon. The daily 5 mg dose is a treatment, not a quick fix. It works by gradually building up in your system to improve blood flow over time. It's not meant to have a strong, immediate effect like the 20 mg dose. Some men start the daily routine, don't see a big change in a few days, and decide it's not working. Then they stop taking it. But it can actually take up to 3 or 4 weeks of taking it consistently every day to really feel the full benefits of this approach. The solution is patience and consistency. If you're prescribed the daily dose, you need to commit to taking it every single day at the same time for at least a month before you can really know if it's working for you. Now that we've talked about the main mistakes, let's quickly go over a few other important things. First, alcohol. While a single glass of wine probably won't cause a problem, drinking too much alcohol is not a good idea when taking Tadalafil. Alcohol is a depressant, which can interfere with the brain signals needed for an erection. It can also affect how well the medication is absorbed and make side effects like dizziness worse. Basically, alcohol can ruin the effects of Tadalafil. Second is the quality of the medication itself. Not all Tadalafil is the same. The quality of the ingredients, how it's made, and how well your body absorbs it can be different between the brand name drug and the generic versions. While many generics are excellent, some from less reliable companies might not be as strong. If you're using a generic and not seeing results, it might be worth talking to your doctor about trying the brand name version or a generic from a very trusted company to see if that makes a difference. Finally, what if you're doing everything right and it's still not working? In that case, it's time to have a serious conversation with your urologist. If Tadalafil isn't working, it could be a sign of a more serious health problem. Erectile dysfunction is often one of the first signs of cardiovascular disease. It could also be related to hormone problems, metabolic issues like diabetes, or nerve damage. Your doctor will need to do a more thorough checkup to find out what's really going on. Don't just assume the medication has failed. See it as a reason to take a closer look at your overall health. And while talking about these things with your doctor is really important, I also want to share something truly remarkable that many men are turning to, especially if they're looking for something beyond just taking pills. It's a different approach, a surprisingly simple, completely natural home remedy that gets to the real cause of male performance issues. It takes just 7 seconds to do, and it's designed to help bring back the strong, reliable erections you had when you were younger, without having to make any big changes to your life. For those of you who want to see this eye-opening discovery for yourselves, there's a QR code appearing on your screen right now. Just open your phone's camera and point it at the code to watch this short, informative video. If you're watching on a device where you can't scan the code, don't worry. The first link in the pinned comment below will take you to the same place. Now, let's finish up with the key things to remember from today's video about Tadalafil. So, to quickly recap, let's go over the important things for taking Tadalafil the right way. Take it at the right time. Take it at least 60 minutes before you plan to be intimate. Be mindful of your diet. Take it on an empty stomach or with a light meal. Remember stimulation. It only works when you're sexually aroused. Relax. Manage stress and anxiety, as they can block the drug's effects. Be patient. If you're taking the daily dose, give it several weeks to work. By avoiding these common mistakes, you can greatly increase your chances of success with Tadalafil. It's a very effective medication when used the right way. Most importantly, please remember that this information is for educational purposes only. Always, and I really mean always, Talk to your doctor before starting or changing how you take any medication. They can give you personalized advice based on your specific health needs. I really hope you found this video helpful. If it gave you some clarity, please give it a thumbs up and think about subscribing for more videos about men's health. And please feel free to share your thoughts in the comments below. Thank you for watching, and I'll see you in the next video.